Good afternoon, myself Deepa Yogi here. I am presenting a video for the job advertisement for an assistant in nursing at St. John Ambulance Australia NSW. In this video, one of the interviewer named Michael is going to ask me two questions. Firstly, he is going to ask me about the verbal and written skills and how I resolve the issues. And secondly, he is going to ask me how can I convey the message to the person and make them fully understand. It would be my greatest achievement to become a part of St. John Ambulance Australia NSW. I am all aware of the essential responsibility of the job and can ensure that I have all the skills required for the delivery and safe care. I am capable of providing care and nursing assistance to patients by working collaboratively as a part of a team within the community as well. Moreover, I am dedicated person and I can take responsibility and accountability for my actions. During my clinical practices, I learned different skills and strategies that required in the delivery of safe care and effective care. I can facilitate compliance with process, documentation and communication with patients and team members. I can promote positive treatment outcomes by adhering to infection practices, policies, and procedure. I can ensure you about my great communication skills, both verbal and non-verbal. I have strong team building skills and can make effective therapeutic relationship with patients. While working in the emergency ward during my placement at Universal College of Medical Sciences, I acquired the skills to work in the dynamic environment and I am capable of making critical decisions. I can provide compassionate care to patients by complying with St. John Ambulance NSW work health and safety guidelines and clinical framework. I have a certificate 3 in health service assistance from Aussie Globe Academy and completed 4 years of bachelor nursing from Sanjivani College of Medical Sciences. If I get selected, I can contribute to achieving the aim of St. John Ambulance NSW care to promote the emotional, physical, cultural, and spiritual well-being of children and young people.
Hi Deepa,
Hello.
it's me Michael, one of the staff hiring member of this organization. Today I'm interviewing you, and are you ready for that?
Yeah, of course.
So I'm going to ask you some questions. This position requires you to have a high level verbal and written communication issue. What happened and how did you contribute to resolve the issue?
Well, communication plays a significant role in nursing as nurses get involved in direct contact with patients and other healthcare professionals. During my past clinical practices, I worked hard to learn effective communication skills. Here, I am describing a scenario of my clinical placement in which I was appointed in the emergency ward at Universal College of Medical Sciences. My job was to assist the patient and help them with their dressing and grooming and observe the tasks performed by the senior nurse. On that particular day, I observed one of my colleagues struggling with assistant or dementia patient. The patient was a 70 years old male admitted to an emergency ward after experiencing a severe abdominal pain due to gastritis. Due to his older age, the patient has impaired hearing and also has an impatient behavior. He also yells as he wanted to go rather than stay in the hospital. My body nurse was assisting him by trying to ask questions, but due to impaired hearing, the patient was not responding. She asked me for help in communication with the patient that she could update his pain score in the medication chart. Being new to the emergency ward, I was not experienced in assisting mentally unstable patients, but during my educational period and training sessions, I learned different forms of communication skills. While communicating with the patient, I positioned myself 2 to 3 feet away from him and kept my sound slightly higher than normal so that he could hear me. I gained his attention by making slight taps on his hand, and then I introduced myself. I ensured I used the right gesture to the patient would not get offended. I started to ask short questions about his pain, like he was nodding his face in yes or no. To promote communication effectiveness, I understood his issue and employed non-verbal communication strategies like establishing eye contact, facilitating lip reading, and avoiding turning away mind sentence. Later, I realized that the use of non-verbal communication skills could prove satisfactory results owing to his impaired hearing issues. Further, using non-verbal communication, I used a digital writing tablet where I showed the screen asking how much you score your pen and then showed a table scoring from 1 to 10. I asked the patient by performing actions to rate how much pain he was experiencing. I allowed the patient to take his time to think. After a few minutes, he tossed the number 6 to ensure what he was trying to say. I repeated, so you score your pain 6, 10. To which they nodded, he said yes. For a final confirmation, I again showed a screen that said his pain score if 6 by 10 and asked him to choose yes or no. He chose yes. In such a way, by using both verbal and written communication strategies, I assist patient in getting his pain score. From the scenario, I concluded that nurses must know how to communicate effectively and be aware of the potential communication barriers and how to overcome them from delivering patient-centered care.
Give me an example of when you had to convey complex information to someone. Explain to me how you made sure the persons understood.
Well, I'm providing an example where I have to convey complex information to a patient. The way nurses talk with patient can affect the shared decision-making caption of patient. When I was appointed to the surgical ward of Zonal Hospital, I experienced a scenario in which a patient named John, who was a 45 years old male, was admitted to the hospital for elective spleen removal. John was obese, which made the surgery challenging, but in the end, everything went well, and nurses was able to ensure safe care delivery. After 4 days of operation, he was discharged from the hospital. Further, at discharge, he had mild persistent abdominal pain for which he was even medicated. After 2 weeks, when he returned for his post-operative checkup, he complained of increasing abdominal pain with low-grade fever from the last 3 days. The doctor suggested he get an X-ray that revealed a surgical sponge was left while surgery. The removal of this surgical sponge need as different surgery which required a readmission to the hospital. My duty was to deliver this critical information to him and schedule the surgery date after taking his consent. During my clinical placements, I witnessed the scenario in which my senior nurse used to deliver complex information, so I had the basic ideas. When I met Joan for the first time, I introduced myself and tried to build a good patient nurse relationship. While interacting, I used open ended questions and avoided vague or only technical jargon so he could clearly understand my words. I recognized that John was not good when complex medical issues are being discussed. Therefore, I engaged his family members as well in the process of information sharing. I make them understand that surgical sponge was left behind during the first surgery, which is a reason for the pain, and to make it better, a second surgery is required. I could clearly observe the confused and worried look on their faces. So, to make patients experience fear and some visual aids, I projected the x ray on the screen and I tried to explain why the second surgery was required. Uh, Studies reported that most patients experience fear and anxiety and face the unexpected consequences of surgery. Similarly, happened in this case. John and his wife panicked when they get to know about the second surgery. Being a nurse, it was my duty to build their confidence and ensure them that the second surgery would be beneficial for him. I drew a representation plan for a surgery to make them understand their situation, as they were already worried. So I allowed him to take some time to make their decision, and I left them in the room. After half an hour, I asked them about their decisions, where John stated that he was ready for surgery after 2 days. Till he wished to get medication for pain management to make sure whether the patient understood what I was trying to explain. I took feedback by using a questionnaire form. I provided the form to John and asked him to answer the provided questions like what part of the needs surgery, or what is the associated condition, does he understand the need for surgery, and whether is he providing his consent to perform the surgery. The feedback form helped evaluate Jones' comprehension of the need for operation and its positive and negative consequences.
Now our interview session has been finished. If you would like to ask any questions for us, you can ask.
Well, there is one questions in my mind, and I'm going to ask you. And the questions is, what's your favorite part about working here?
Well, I have always been interested in work that involves helping others and making positive impacts. I enjoy being an active member of my community and helping people. So I love doing leadership management here, and I am enjoying my job. And other than that, the people, all of the staffs, all of the colleagues here are very friendly, and they love doing this job with cooperation and with a team as a teamwork. And so I'm enjoying a lot in this job.
Thank you.